Today I brought some reading about how we manage gout. We will talk about the target in gout, the uric acid level target range, and the medications we use. A little bit background about gout. Gout happens because of high uric acid level. Uric acid accumulate in the joint. So the treatment is focused on lowering the uric acid level in our blood. And the target range is typically, as you can see, below 6. And this is the number we say, oh yeah, unlikely the uric acid will accumulate in the joint. Oftentimes, the gout still happens despite better uric acid level, in which case we often target lower number, but 6.0 could be the primary target range. Of course, there are other non-pharmaceutical interventions your doctor will recommend, but it doesn't always work, in which case many times we end up using some medications. And the first line treatment is typically low dose allopurinol. We start with 100 milligram a day. It typically works great, but if it doesn't work or allopurinol is contraindicated, then we can use other agents. Most popular one is going to be febuxostat. I remember they also mentioned about, prophylactic. Yes, here. When we start the uric acid lowering agent, we often see the flare because of uric acid lowering agent. To prevent this, oftentimes we prescribe other flare preventing medications together. Here, during the initiation of the uric acid lowering therapy, American College of Rheumatology and American College of Physicians both recommend concomitant these anti-inflammatory agents, most commonly colchicine and low-dose ibuprofen like a naproxen 250 milligram twice a day. We typically continue it for at least 3 to 6 months. And after that, the risk of flare because of allopurinol or febuxostat is not as high as it used to be, so we don't continue that. For patients who do not reach uric acid target range, then we can use other agents. But to be honest with you, I've never prescribed it before. Typically at this point, we refer our patients to rheumatology for further support. So we just briefly reviewed about how we manage the uric acid. Target is 6.0, and we used allopurinol. When allopurinol is contraindicated, we can use febuxostat. And at the beginning of the journey, because of risk of flare from allopurinol or febuxostat, we oftentimes use other agents to prevent the flare, like colchicine, and the dose is written here, 0.6 milligram twice a day, or low dose NSAID, naproxen 250 milligram twice a day, typically for 3 to 6 months. So this is how we treat the uric acid. If you have any questions, please feel free to leave a comment. I will open the live stream in the future with a different topic. Thank you so much for watching.